Hi, I'm Michelle Harris. I'm the Director of Homes and Senior Services for the County of Elgin Homes. It's my pleasure today to speak to you about resuming visits and absences during a pandemic in our 3 homes. Elgin County's long-term care home staff have worked tirelessly throughout the pandemic to keep our 247 residents safe from COVID-19. Our approach has been and continues to be measured and cautious. We remain diligent in protecting our residents and staff as the possibility of spread of COVID-19 still exists in our homes. As families and friends, we understand and support the critical role each of you play in our residents' lives, and we thank you for your patience while we work through the processes to ensure we have all necessary measures in place to continue to safeguard your loved one's health and well-being. We recognize that visits and time away from the home play a vital role in providing care and emotional support for residents. We also recognize that visitor restrictions have been very difficult for residents, families, and loved ones. I am pleased to share some important updates with you today. On August 28, 2020, the Ministry of Long-Term Care announced changes to short stay absences, meaning those who leave the home for healthcare related, social, or other reasons, and temporary absences, meaning for those who leave the home for 1 or more nights. And on September 2nd, 2020, the Ministry of Long-Term Care released a document called Resuming Visits in Long-Term Care Homes. This document speaks to effective September 9th, 2020, up to 2 essential visitors and general visitors are permitted in long-term care homes. Elgin County's long-term care continues to work very closely with Southwestern Public Health to both assess and improve preparedness for responding to COVID-19. This includes the development and implementation of policies and processes to support the resumption of essential visitors, general visitors, and prearranged absences. When we developed our policy, we looked at guiding principles for visitor and absences. The first guiding principle is safety. This principle speaks to any approach to visiting must balance the health and safety needs of residents, staff, and visitors and ensure risks are mitigated. The second principle is emotional well-being. Allowing visitors is intended to support the emotional well-being of residents by reducing any potential negative impacts related to social isolation. The third principle, equitable access. All residents must be given equitable access to receive visitors consistent with their preferences and within reasonable restrictions that safeguard residents. The fourth principle, flexibility. The physical or the infrastructure characteristics of the home, its staffing availability, whether the home is in outbreak, and the current status of the home with respect to PE are all variables considered in the development of this policy. Final principle, equality. Residents have the right to choose their visitors. In addition, residents and or their substitute decision makers have the right to designate caregivers. Policies and procedures have been developed and are in place for visiting. That includes virtual visits, window visits, outdoor visits, and indoor visits. As well, we have a policy to address absences. Short stay absences, which include healthcare related, social, or other reasons, and temporary absences for those residents who leave the home for 1 or more nights. Visitors should consider their personal health and susceptibility to the virus in determining whether visiting a long-term care home is appropriate. There are 2 types of visitors defined for long-term care homes in the updated guidelines. The first type is essential visitors. Within this category, there is a support worker, visits who performs essential support services. That could include a physician, persons to perform lab work, foot care, etc. Then there is the caregiver. The caregiver visitor is designated by the resident and or the substitute decision maker. This could be a family member, privately hired caregiver, a paid companion, a translator. They are visiting to provide direct care to the resident. Some examples include supporting feeding, mobility, personal hygiene, cognitive stimulation, communication, meaningful connection, and assistance in decision making. The second type of visitor is a general visitor. The general visitor is not an essential visitor. They are visiting to provide non-essential services and or for social reasons. There are some measures being put into place to support safe visits at the County of Elgin homes. The visitor requirements include self-screening. All visitors must self-screen for COVID-19 symptoms prior to visiting. If you fail to self-screen, we ask that you reschedule your visit. Active screening. All visitors will be screened on entry for symptoms and exposures to COVID-19, including temperature checks. Attestation. All visitors must attest to the home that they have tested negative for COVID-19 within the previous 2 weeks and not subsequently tested positive. An exception to this would be for outdoor and window and virtual visits, and for emergency situations such as persons visiting a very ill or palliative resident. Attestation. All visitors must attest that in the last 14 days, they have not visited another home in an outbreak or a resident who is self-isolating or symptomatic. Prior to visiting any resident for the first time and at least once every month thereafter, visitors must attest to the home that they have read or reread the home's visitor policy and that they completed the required infection prevention and control education. All visitors are expected to physical distance from other residents and other visitors. There are education requirements that I just spoke to are available on the County of Elgin Homes website for infection prevention and control, otherwise termed IPAC, and personal protective equipment, otherwise termed PPE. They include videos for putting on and taking off full PPE and one-piece facial protection and how to hand wash. These are Public Health Ontario resources. It may be helpful to do some questions and answers. The first question: who supplies personal protective equipment for visitors? Answer: the home supplies indoor visitors with a surgical or procedural mask and other required PPE. The outdoor visitor supplies their own cloth mask or face covering for outdoor visits. Question: will visits be supervised? Homes are not required to supervise visits, but have the discretion to do so in order to manage health and safety of staff, residents, and visitors during visits. Any supervision of visits should respect the resident's right to communicate in confidence, to receive visitors of their choice, and to consult in private with any person without interference. The next question: how is it determined who gets to visit, how many visitors, and when? Answer: homes have discretion to manage visits as appropriate to balance the safety of residents, staff, and visitors with the needs of the home and its residents. The resident or substitute decision maker may designate up to 2 essential caregiver visitors. The caregiver visitor must be 18 years of age. There is a maximum of 2 caregiver visitors per resident visiting at any time. They must remain with the resident and not visit with any other resident or visitor in the home. Caregiver visitors are encouraged to advise the home as to when they plan to visit to support equitable access to visitors for all residents. A resident may have up to 2 general visitors at a time. General visitors younger than 14 years of age should be accompanied by an adult. General visitors are not permitted if the home is an outbreak or the resident is self-isolating or symptomatic. Homes have the discretion to require visits by general visitors to be scheduled in advance, limited in time, provided the visit is at least 30 minutes, starting from the time the visitor and the resident have arrived to the visiting area, and limited in frequency, provided a resident receives at least 1 visit per week. Question: where might visits occur in the home? Answer: dedicated outdoor space, a resident room, or common areas of the home. Question: how are locations of visits determined? Answer: space available in the location for physical distancing is key in determining the location of your visit. Staffing capacity for transferring residents into and out of the visiting location and providing guidance or escorting visitors to the visiting locations is important, and the number of visitors on site at the time of each visit is key. Question: are there procedures for responding to non-adherence by visitors in the home? Answer: yes. These include supporting visitors in understanding and adhering to the home's visitor policy, recognizing visits as critical to supporting a resident's care needs and emotional well-being, considering the impact of discontinuing visits on the resident's clinical and emotional well-being, reflecting and being proportionate to the severity of the non-adherence, and where the home ends a visit or temporarily prohibits a visitor, specifies any education or training the visitor may need to complete before visiting the home again. Homes may end a visit after repeated non-adherence. Homes may temporarily prohibit a visitor in response to repeated and flagrant non-adherence within the home's visitor policy. Any decision to temporarily prohibit a visitor should be made after all other reasonable efforts to maintain safety during visits have been exhausted. Homes shall stipulate a reasonable length of the prohibition, identify what requirements the visitors should meet before resuming visits. Where the home has temporarily prohibited a caregiver visitor, the resident and/or their SDM may need to designate an alternate individual as caregiver to help meet the resident's care needs. Next, I'm going to speak about absences. As a reminder, there are two types of absences: short stay and temporary. Requirements for individuals taking resident out for any absence include self-screening. Again, we ask all individuals picking the resident up for an absence or having contact with the resident to self-screen for COVID-19 symptoms prior to visiting. If you fail to self-screen, we ask that you reschedule the absence. Active screening. All individuals picking the resident up for an absence will be screened on entry for symptoms and exposures to COVID-19. This will include a temperature check. Attestation. All individuals picking the resident up for an outing must attest to the home that they have tested negative for COVID-19 within the previous 2 weeks and not subsequently tested positive. Attestation. All individuals picking the resident up for an absence must attest that in the last 14 days, they have not visited another home in an outbreak or a resident who is self-isolating or symptomatic. Prior to any absence with any resident for the first time, and at least once every month thereafter, individuals taking a resident out on an absence must attest to the home that they have read or reread the home's visitor policy and completed the required infection prevention and control education. So we'll speak about short stay absences next. This is an absence where the resident may leave the home's property for healthcare related, social, or other reasons. It does not include an overnight stay. This visit or absence must be prearranged or scheduled at least 24 hours in advance and must include the nature of the absence, date of the absence, duration, location where the resident will be going, and the individuals the resident will be interacting with. A risk assessment will be completed prior to the absence. If the planned absence is deemed to put the resident at risk of exposure, the family member or friend will be asked to make alternative arrangements for the absence. The capable resident must agree to the absence. All family members or friends must self-screen prior to the absence. A negative COVID-19 test is required for the individual picking the resident. The resident must also pass active screening prior to leaving the home, and the resident must be provided a medical mask to be worn at all times when outside the home if tolerated. The home will provide the resident with the mask. Residents, family, and friends are reminded about the importance of infection prevention and control measures, including but not limited to physical distancing, hand hygiene, mask etiquette, respiratory etiquette, social circles, etc. Upon return to the home from a short stay absence, the resident will be actively screened. Self-isolation is not required unless the resident had any high-risk activity, experienced symptoms, or had a known exposure during their short stay absence. The resident will be tested for COVID-19 with the next round of routine testing following the outing. Short stay absences will be canceled in the event of an outbreak at the home and/or as per ministry or public health direction. The second type of absence is the temporary absence. Residents may leave the home's property for a temporary absence for 1 or more nights for personal reasons. Temporary absences must be prearranged and scheduled at least 5 days in advance of the absence and must include the nature of the absence, the date of the absence, the duration, the location where the resident will be going, and the individuals the resident will be interacting with. A risk assessment will be completed prior to the absence, which will include the home's ability to support self-isolation for 14 days upon the resident's return, local disease transmission and activity, the risk associated with the planned activities that will be undertaken by the resident while out of the home, the resident's ability to comply with local and provincial policies or bylaws. If the planned absence is deemed to put the resident at risk of exposure, the family member or friend will be asked to make alternative arrangements for the absence. If the home denies a temporary absence request, the home will communicate to the resident or SDM in writing, including the rationale for the decision. Resident must agree to the temporary absence, and they must agree to the 14 days of self-isolation upon return to the home. All family members or friends must self-screen prior to the temporary absence. A negative COVID-19 test is required for the individual picking up the resident. The resident must pass active screening prior to leaving the home. The resident must be provided a medical mask to be worn at all times when outside the home if tolerated, and family members will be required to provide additional PPE as required during the temporary absence. Residents, family, and friends are reminded again about the importance of infection prevention and control measures, including but not limited to physical distancing, hand hygiene, mask etiquette, respiratory etiquette, and social distancing. Or social circles, sorry. Upon return to the home, the resident must be actively screened, and the resident will be required to self-isolate for 14 days. The resident will also be required to be tested for COVID-19. The testing will be done 72 hours after return from temporary absence or upon return to the home if the resident is experiencing symptoms or had a known exposure during temporary absence. Temporary absences will be canceled in the event of an outbreak at the home and or as per ministry or public health direction. Enabling safe visits and short-stay temporary absences is a top priority for the Elgin County Homes. We would sincerely like to thank family members and friends of our residents for their ongoing support for the home staff as they continue to prioritize the safety of your loved ones. Please contact the home directly to schedule your visit or absence, and on the screen you'll see the email addresses and the phone numbers for calling to book your visits or your absences. Thank you very much for joining me today in this presentation. We look forward to seeing you all soon at the homes. Thank you.